no longer in a COVID pandemic. What we are facing is much more complex. You could think of it more like a multi-demic. Yes, COVID cases are on the rise again, but we also have influenza, RSV, and other respiratory viruses circulating in the community. We're here with Professor Robert Booy, paediatric infectious disease specialist, epidemiologist and vaccinologist. Thank you for joining us here with Pathology Technology Australia.
Really good to be with you.
Professor, we're experiencing this multi-demic situation. What do you see as the most important actions we can take? And are these fundamentally different from what we've been doing these past 2+ years?
We're in an amazingly unusual situation. Because we shut our borders for 2 years and had social distancing, we've got a situation now where a whole raft of viruses are coming back. Influenza, COVID with a force, RSV, adeno, parainfluenza, rhinovirus. They're a real challenge this winter in Australia, and we have to take measures to control them. Some of them are simple public health measures that we've done before. Distancing, masks indoors, hand washing, but some of them are specific, like testing for viruses. And by testing for viruses, we can find specific viruses that can be managed, that can be treated. There's the general approach of test and isolate and quarantine, but there's also the specific approach, antivirals for things like influenza and COVID.
And what is your position on the impact of testing and the role that plays now and in the future?
Testing for respiratory viruses in Australian people, in fact around the world, is really important. We can find the exact cause of an infection, and we can even sequence it to find out what's special about that virus. Particularly in Australia right now, we have the facility and the opportunity to test for viruses and to get a result within minutes to hours. That can lead to medical decisions which are helpful and can lead to prevention of outbreaks in places like nursing homes and community centres, which would otherwise be a real problem.
We're seeing mixed messages about the value of rapid antigen testing versus PCR. Can you help us understand the difference between RATs and PCR and where they're both best employed?
Rapid antigen tests, called RATs for short, are, as they say, rapid, and they can give you a result within minutes. They're very effective, but if you get a negative test, it doesn't mean you don't have a particular virus. And even some people who test themselves twice, 2 days in a row, can get negative tests. So if you remain symptomatic, if you're worried about your infection, you can get a PCR test, which is more reliable, more accurate, and takes a little bit longer, but it gives you a more certain result.
Finally, we saw the ABC banana mascots B1 and B2 play out when Omicron BA1 and BA2 were circulating. Where do we go with BA5? Can we name this new nemesis we are facing?
BA1 and BA2, I call them banana 1 and banana 2, but they're much more threatening than cartoon characters. They actually have caused death and disease at a very high level in Australia. But we then got BA5, which is even more transmissible and has been causing even more deaths. BA5 is a bit like Jupiter. It's the biggest yet. It's the 5th planet from the sun, Jupiter. So I call it Jupiter rising because it's getting worse and worse, and it's something that we really need to respond fast and quickly and effectively against.
Well, thank you, Professor, for joining us today and helping us understand what we're seeing out in the community. And remember, if you're experiencing respiratory symptoms, go out and get yourself tested.